Hi, this is Valerie DeCamp, and I'm going to present a nursing research project today, the Melnick Model of Evidence-Based Practice. And again, I'm Valerie DeCamp, Vice President of Clinical Integration and Chief Quality Officer. I've been at SYMC for 40 plus years and a nurse for 41. So I'm going to start out with a review of what evidence-based practice is. It's a problem-solving approach to the delivery of healthcare that integrates the best evidence from well-designed studies and patient care data and combines it with patient preferences, values, and nurse expertise. The Institute of Medicine set a goal that by 2020, and of course we're in 2021, that 90% of all healthcare decisions will be evidence-based. So really a push to move away from the way we've always done it to making sure there's some evidence to back up what we are doing. And then without EBP, patients do not receive the highest quality of care. And the Melnick model is a model that helps hospitals implement the process of using evidence-based practice. And a few years ago, Dr. Melnick did attend our nursing research symposium, and that's what piqued our interest. So just a review of the Melnick model. It's 7 steps. Step 0 is to cultivate a spirit of inquiry. What can we do to motivate and energize, light a fire to begin looking at the evidence? Step 1 is ask clinical questions using the PICO format. Step 2 is search for the best evidence. Step 3 is critically appraise the evidence. Step 4 is integrate the evidence. Step 5 is evaluate the outcomes of the practice decisions or changes based on evidence. So you'll want to have pre-data and post-data to make sure that things are working. And then step 6 is disseminate the EBP results. So just a little history on the process for this research study. Prior to implementing the Melnick model of EBP, a survey monkey was sent to all RN staff at SYMC to help determine beliefs about EBP and readiness to implement. Once that survey was complete, we adopted the Melnick model, and implementation included education about that model. Then 1 year post-implementation, the RN staff were surveyed again using the same survey as pre-implementation to see if the implementation of the Melnick model of EBP made a positive difference in EBP implementation and beliefs. Permission to use the EBP beliefs and implementation scales was granted by Dr. Melnick. So our PICO question, does education about the Melnick model of evidence-based practice improve knowledge and adoption of EBP as measured by a pre-test and post-test? So here are the results, including 2019 and 2020. So in this question 1, we asked the gender, and so pretty typical to healthcare. There were more females than males in both 2019 and 2020. We also asked their position, and so the large majority were registered nurses in both years, followed by charge nurses, then specialist nurses, and professional development nurses. Question 3, ask about their employment status. So again, most respondents in both years were full-time, followed by part-time and then other. Question 4 was about patient contact. So the large majority of those who responded in both 2019 and 2020 had patient contact. Question 5 was related to the highest level of training. Did they have basic nurse training, or did they have some further training or advanced training? So the majority of respondents had some advanced training in both years. Question 6 was related to knowledge about evidence-based practice. So a large majority of both years had previous experience. And then question 7 was, how did the respondent learn about evidence-based practice? The majority of respondents in both years learned that on the job. And then you can see the rest of the results by basic training, EBP postgraduate, a course related to evidence-based practice, or other. And then question 8 was a yes/no question, participation in an EBP working group. The large majority in both years have not participated in a group where EBP was either discussed or used. Question 9 was related to the type of EBP working group, and the large majority in both of those years were professional procedures. That's where they learned. And writing articles was the remaining. Question 10, I believe that EBP results in the best clinical care for patients. Now here's where we start measuring agree and strongly agree responses. So in 2019, 64% of the respondents believed that it resulted in the best clinical care for patients. And then in 2020, only 48% agreed. So if you look there at the bottom, we're looking at the p-value of 0.34, and a p-value measures statistical significance. And a p-value of greater than 0.05 means the intervention had no effect, and if it's less than 0.05, it represents clinical significance. So question 11, in 2019, 54.5% of the respondents said, I'm clear about the steps of EBP. And then we had our intervention, and afterwards, 43.5% were clear. In quarter 12, I am sure that I can implement EBP, 61.5%. Felt sure, agree and strongly agree compared to 2020, which was 50.5. You're going to see a pattern here of decreased results between 2019 and 2020. Question 13, I believe that critically appraising evidence is an important step in the EBP process. Again, we had a decrease. Same thing with I am sure that evidence-based guidelines can improve clinical care. Question 15, I believe that I can search for the best evidence to overcome, or excuse me, best evidence to answer clinical questions in a time-efficient way. Again, declining results from 2019 to 2020. Question 16 is I believe that I can overcome barriers in implementing EBP. Again, declining answers from both years. Question 17, I'm sure that I can implement EBP in a time-efficient way. Same here again, declining results from pre-survey to post-survey. Question 18, I am sure that implementing EBP will improve the care that I deliver to my patients. 64.5%. Agreed or strongly agreed in 2019 and 49% in 2020. Question 19, I am sure about how to measure the outcomes of clinical care. Again, we had a decline. Question 20, I believe that EBP takes too much time. And I have a typo there, or excuse me, there's no typo there. 6% agreed and 6.5 or 4.5% strongly agreed. Question 21, I'm sure that I can access the best resources in order to implement EBP. 57.5% in 2019 compared to 2020 with a result of 41%. Question 22, I believe EBP is difficult. 11% agreed or strongly agreed. 6.5% in 2020 agreed or strongly agreed. Question 23, I know how to implement EBP sufficiently enough to make practice changes. 52.5% in 2019 strongly agreed, and 40.5% in 2020 strongly agreed or agreed. On question 24, I am confident about my ability to implement EVP where I work. 2019, 57.5% agreed or strongly agreed, and in 2020, 42.5% agreed or strongly agreed. In question 25, I believe the care that I deliver is evidence-based. In 2019, 66.5% of the respondents agreed or strongly agreed, and in 2020, 47.5% agreed or strongly agreed. Question 26, used evidence to change my clinical practice. 34% agreed or strongly agreed in 2019, and 29% agreed or strongly agreed in 2020. Question 27, critically appraised evidence from a research study. So in 2019, 23% of the respondents critically appraised evidence, and in 2020, 18.5%. In question 28, generated a PICO question about my clinical practice. 5.5% of the respondents agreed or strongly agreed in 2019, and 7.5% agreed or strongly agreed in 2020. That was I'll go back to that. That was our only, or that was one of the improvements that we saw. In question 29, informally discussed evidence from a research study with a colleague. In 2019, 28% agreed or strongly agreed, and then in 2020, 25% agreed or strongly agreed. Question 30, shared evidence from a study in the form of a report or presentation to more than 2 colleagues. In 2019, 13% of the respondents agreed or strongly agreed, and in 2020, 12% agreed or strongly agreed. Question 31, 17.5% of the respondents agreed or strongly agreed that they evaluated the outcomes of a practice change, and that decreased to 10% in 2020. In 2019, 19.5% of the respondents shared an evidence-based practice guideline with a colleague, and in 2020 that decreased to 19%. Question 33, shared evidence from a research study with a family or a patient or family member. So in 2019, 18% agreed or strongly agreed, and in 2020, 16.5% agreed or strongly agreed. Question 34, shared evidence from a research study with a multidisciplinary team member. This is one of the questions that showed a slight increase. So in 2019, 14% agreed or strongly agreed, and in 2020, 14.5% agreed or strongly agreed. If you're looking at those p-values as I'm going through each one of these, I didn't want to take the time to read, but you're seeing a lack of statistical significance. And then question 35 was, I read and critically appraised a clinical research study. In 2019, 21% did, or agreed and strongly agreed, and in 2020, 16% agreed and strongly agreed. Question 36 was access the Cochrane database of systematic reviews. In 2019, 17.5% agreed or strongly agreed, and in 2020, 13.5% agreed or strongly agreed. Question 37 was access the National Guidelines Clearinghouse. So in 2019, 9% strongly agreed or strongly agreed that they access the National Guidelines Clearinghouse, and then 2020, 8.5% agreed or strongly agreed they access the clearinghouse. Question 38 was use an evidence-based guideline or systematic review to change clinical practice where I work. So in 2019, 11% of the respondents agreed or strongly agreed, and in 2020, 12%. So a slight increase there. Question 39 is evaluated a care initiative by collecting patient outcome data. And in 2019, 10% agreed and strongly agreed, and then 2020, 8%. Question 40, shared outcome data collected with colleagues. In 2019, 9% did, and in 2020, 10% agreed or strongly agreed. So another question with an improvement. Question 41, change practice based on patient outcome data. In 2019, 13% of the respondents agreed or strongly agreed, and in 2020, 8.5% agreed or strongly agreed. Question 42, promoted the use of EBP to my colleagues. And here we have in 2019, 21.5% agreed and strongly agreed, and in 2020, 20% agreed and strongly agreed. So that is the last of the questions. And then just to summarize the findings, 4 questions showed an improvement of agree and strongly agree results from pre and post screening. Those were question 28, 34, 38, and 40. And while these questions don't represent statistical improvement, they do represent clinical significance. So anytime there's an improvement in results, clinical significance exists. But as I've said throughout the presentation, the study lacks statistical significance for all questions. Now, I do believe there are some confounding factors in the results here. The COVID-19 pandemic was the focus in 2020, and as it continues to be. And then implementation of a new HR and the required education focus, I believe folks weren't necessarily focused on EBP and learning more about that. Thank you for your attention.